Welcome to Periop Talk. I'm Janine Watson, Senior Manager of the Ambulatory Surgery Division with AORN.
And I'm Johnny Marr, Ambulatory Perioperative Education Specialist at AORN.
ASC administrators serve as the liaison to the medical staff and are delegated administrative authority by the governing body. They are responsible for reporting key data and information to the governing body and building positive relationships.
In this episode, we welcome Dr. Tamala Norris-McJunkins. She's the Senior Vice President and Enterprise Chief Clinical Officer for Surgery Partners.
Tamala brings a wealth of experience and will be able to provide insight on how to develop rapport, navigate challenges, and effectively communicate and collaborate with your governing body.
Tamala, thanks for joining us today. Can you start by explaining the role of a governing body in an ASC? I mean, who typically sits on these boards and what are their primary responsibilities?
So on a governing board for ASC, role is, according to accrediting bodies, our CMS, whether you are accredited by AAAHC or Joint Commission, the governing board has oversight really for everything within the facility, from the financial responsibilities to the quality and safety. They are also responsible for any of those clinical processes and making decisions that drive improvement in the ASC. So who usually sits on the governing board, you're going to see your administrator. Usually your clinical leader will attend but not be a member. Your medical director and your business office manager will come and present, but they're typically not a member of the board. The board members will be typically physicians that are a part of your team. On occasion, we may have a community representative as well who participates in the board, but you will have usually your physician representation. That is going to be the majority of your board representation, as well as your administrator, and then your support cast who will provide information to the board so that they can make decisions.
I see. So you said community member. I hadn't heard that before. Can you explain that a little bit more?
So some ASCs now have started to bring in community members as a member of their board to give that perspective from the community and the patient. So the ASC and where they're located and how they support that community and the needs of the community. So being able to get that outside perspective, someone who's not in the building, of how we take care of our patients. What are some of the things that we need to do to continue to support the community that we're serving? And so having an individual that previously was a patient, it may be an elected official, it might be someone who owns a business in the community, but they have a vested interest in the health of the people in that community and can provide some insight to the board.
What a great way to bring in a different perspective.
Yeah, that's such a great idea.
So since the governing body has responsibility for oversight for everything, how does the administrator decide how to give them information, and how is this information typically shared?
There are some things that need to go to the board on a routine basis, things like policies, our quality metrics and safety metrics. Financial components and how we're doing from a financial perspective on the ASC. There's also going to be things that involve decision making, like possibly capital expenses. While the administrator is running the facility from day to day and handling a lot of those operational pieces, the governing board then needs that information so that they can make informed decisions about the progress of the ASC and where we're going in the future with the ASC. We'll have what's presented to them is anyone who has come up for credentialing and re-credentialing and providing them with that information, but them being able to give feedback. The governing board is there as a body to have oversight of the ASC and make decisions that are in the best interest of the ASC, from how we drive patient care to how we manage the finances within the building.
So you mentioned that the regulatory and accreditation bodies have requirements for reporting. In addition to those items that are required to be reported, how do you decide what else to report? What's important to your board? Do you have an example of what you may include or admit from these meetings?
So they're outside of our quality metrics and policies and safety. There's those environmental plan of correction or plans that we want to make sure that we get to the board. But you also want to take some of your patient experience pieces. What are our patients saying? Your performance improvement projects. What have we identified as an opportunity? Anything that may come up with the medical staff that the board needs to impart some decisions on. If we have opportunities with some of our providers or a single provider, the board needs to hear about those actions and how we address those things. And so a lot of what's driven outside of those regulatory requirements, what's driven as what we take to the board are things that they would need to impart some decisions on or be informed about. We want to make sure that we are moving information up to the governing board and that we're also then sharing that down to our frontline teams. But they have to have insight as to the workings of the ASC and how that goes so that they again can help decide where do we need to move. Things like capital items. We need to purchase a new piece of equipment. Board, do you support that? Or we need to bring on a new physician. Here's the review of that physician. Governing board, we would like for you to approve this or provide any additional feedback. Those are some of the things that we take to the board and get their feedback and their advice and their direction on.
That's great. So clearly getting the right information to the board is incredibly important. What positive changes maybe have you experienced or could one expect when an ASC leaders delivers the accurate and meaningful data to the governing board?
So one of the things I'd expect to see is that the information that's given to the governing board is concise and to the point. There's a lot of things for us to share with them. So we want to make sure that the information we're giving them is pertinent, that it's concise, but we're getting them all of the things that they need to know, again, so they can make those decisions. So when we see a really positive governing board, information is presented to them and they're able to vote or have discussions about the information that was provided and then be able to make a final decision that the administrator can take back and act on. So really good information comes from having that concise data. You want to put it in a format that's understandable and easily digestible. Graphs are a great way to be able to share some of that quality data. Tables, when we're looking at that financial data, you want to minimize the number of words that you're having to use to be able to get the information across, yet still getting that pertinent detail that they need.
So if everyone's kind of if they're condensing the information that they have, I mean, how long should they schedule these meetings for from the get-go? Should these be scheduled for 30 minutes, an hour, 2 hours? What's an appropriate length to sort of present this information?
Most governing board meetings last anywhere from 1 to 2 hours. On occasion, when we have something a little bit more that we need to discuss, like in an executive session, or we need some more detail, or there's some very urgent decisions that may need to be made, or a lot of information that needs to be covered. Those can go up to 3 hours, but on the typical, you're going to see a governing board meeting that's from 1 to 2 hours.
And how often should they do these meetings? Should they do them monthly, quarterly? What's the best cadence that you found for this?
So best practice for a governing board meeting is to have one quarterly. On occasion, there may be facilities who like to meet monthly, and the governing board can drive that decision. But on average, most governing boards meet once a quarter. That's the best practice, and that's the cadence that we see most often.
Perfect. Are there any common communication barriers when interacting with the governing body? I mean, what advice would you give to a young administrator or a first-time ASC leader who's never facilitated governing body meetings and now they are for the first time? They're very nervous. What sort of advice would you give to them to start leading those meetings?
So I would say one, do some research. Actually look at the previous governing board minutes, agendas, and you want to be able to pattern information after that. You also want to work with your medical director and your direct leader, whether that's your regional leader, if you have a management company, working with the leader over the ASC for the management company to understand the flow of a governing board meeting. And you want to make sure that you're prepared. So going into your first meeting, you want to make sure that you have all of the documents that you need. You want to present things in the similar fashion that the board is used to seeing. At the end of that, then you want to start getting some feedback about any additional ideas you may have, anything that the board might want to know, that they're information that they're not currently getting. And then you can start to tailor your governing board presentations behind that feedback that you receive. And so don't be afraid to talk to your leaders. For most administrators, the governing board was involved in the decision to bring you in. And so you want to be able to talk to them. You want to make sure that you build a relationship with your board, that you're transparent with your board. And initially, just making sure that you're using the other subject matter experts and the other individuals with history to help guide that very first meeting. Now, the first one's you're going to be a little bit nervous, but when you stick to the script that everyone is used to, it makes things flow a little bit better and you will come into your own. You will develop a cadence and a structure that fits you and fits the governing board.
Practice makes perfect, right?
That's right.
Yeah.
This is such great information. I love the idea of feedback. I think sometimes we're afraid to request feedback because we want to do things a certain way, but I think that's some great advice. So I have another question for you. Since it is hard to determine and new administrators may not be sure exactly what to present to the board, have you ever experienced a situation where a critical issue wasn't communicated either effectively or timely to the board? If so, were there consequences and how do you address it moving forward?
So I have had that happen at a facility where some of the information was not communicated to the board in a timely manner for them to be able to make an appropriate decision. Some of the key details that they needed to be able to make the decision they needed to make were condensed or were not quite communicated in a way that they truly understood and grasped what was going on. As a result of that, there had to be an ad hoc meeting where the governing board was brought back to have a further discussion. We needed to share some additional details with them so that they then could make a decision. So at the time we left and there wasn't a decision made, we had to have another meeting where they received everything that they needed. And we were able to leave that meeting successfully with a decision that we could use to drive and move on.
That makes sense. Thank you. Also, you mentioned data. And so do you have an example where you presented specific data and was able to either secure resources, implement policy or practice changes because of your data?
Yeah. So as we look at some of those quality and safety metrics, when we saw opportunities with some of our data, being able to explain to the governing board the why behind the change in the data and what was needed to be able to drive that improvement. So being able to share that we need a new piece of equipment or we're going to change this process so that we can make sure that this does not happen again. Or we believe that if we make these changes in how we practice, we can be proactive in preventing any quality or safety issues for our patients. And so being able to give the board the why behind what we're doing, presenting the numbers, especially trended numbers over time, to be able to show them where we are and what we need to do. You see a lot of this when it comes to maybe supply chain opportunities or how we manage medicine. It may be responses that we're getting back from surveys and patient care pieces that they've shared with us. But looking at your data, being able to look at those numbers and understand. And for the board, we have a responsibility for interpreting that data. You never want to take a big, you will never want to take a big table or graphs to the board and you can't give them the information behind that. We have to then take that data and interpret it in a way that the board understands it so then they can make their suggestions, their recommendations, and final decisions.
This is all such great advice. If you could leave one last piece of advice for ASC admins, how can they manage their board? I mean, what would that piece of advice be?
So I would say the one thing that I would leave an ASC, a new ASC administrator with, is to be prepared. Okay. Be prepared with the information and the data that you need to be able to answer the questions of your governing board. You're in your facility every day. You're managing the day-to-day pieces in business, and you have a lot of information that you keep and that you're aware of. Your governing board members are not there on a daily basis, nor do they have that inside knowledge related to events or the finances. And those are all things that we need to share with them. So making sure that you are armed with the information that you need to be able to answer questions is one of the best ways for you to start out very well with your governing board and build a great relationship.
This has been great advice. Tamala, we want to thank you for joining us today, for sharing your insight, experience, lessons learned, and tips for success for our new administrators.
What a great conversation. I mean, she is just so knowledgeable. As a new ASC leader, I gathered so much great tidbits out of that conversation. Janine, as somebody that's experienced in the ASC and has been doing this for a long time, is there anything that jumped out at you or anything that you would reinforce?
Oh, sure, Johnny. I think the biggest takeaway for me was the reminder that the governing body and the medical director are not involved in the daily operations and they really don't know everything that's going on. So it's important for us to share that information with them and keep them in the loop.
That's such a great point. I know we talked about cadences of meetings and she mentioned doing those quarterly, but also not holding back on important data that could affect clinical operations or business operations, over that long period of time. If you need to talk sooner as a group, go ahead and have that conversation.
I agree. I think that's very important to understand. I'd also be interested to hear what our listeners think. Please put in the comments anything that you have to add to this conversation or tips or tricks that you use to prepare for your governing body meetings.
Absolutely. We look forward to reading those comments. Thank you everyone for listening today and joining us on Periop Talk.
Thank you.